You're watching Baptist Health's Resource Live, where our respected experts bring you timely and practical health and wellness information to improve your family's way of life. We're healthcare that cares. This is Resource Live.
Hi, everyone. I'm Dr. Jonathan Fialco, Chief Population Health Officer for Baptist Health South Florida, coming to you live from the Baptist Health Newsroom. Alcohol is all around us at family dinners, Sunday brunches, get-togethers with friends. Some studies even say that drinking wine in moderation is good for our health. We may have a drink or two on a social occasion, not even thinking about it, but there are studies that are linking drinking alcohol with hypertension and even some cancers, even when done in moderation. Long-term use can cause serious health complications, including liver disease, heart failure, and you don't have to suffer from alcoholism to experience these consequences. There are estimated 17 million adults in the US who do suffer from alcoholism. The pandemic is not helping us lessen these numbers. Researchers say that binge drinking, especially among women, has increased significantly during the COVID-19 pandemic. It's important to note that alcoholism is a disease. It's chronic, it's progressive, and sometimes fatal in nature. April is Alcohol Awareness Month, and today we're going to talk to three experts from the Baptist Health family about the effects of alcohol, no matter how much you drink, and how to help a loved one who may be battling alcoholism. I'd like to welcome to this important conversation Dr. Kevin Wandler, Chief Medical Officer of the Advanced Recovery Systems. Welcome, Kevin.
Welcome. Glad to be here.
Dr. Thomas Hammond, neurologist with Baptist Health's Marcus Neuroscience Institute. Thanks for being here, Thomas.
Oh, glad to be with you.
And Dr. Caitlin Elsbeth Ross, family medicine physician with the Baptist Health South Florida Medical Group. It's a pleasure to have you with us today, Caitlin, as well.
Thank you for having me.
Okay. Before we dive into today's subjects, I want to remind our viewers to send your questions and comments throughout the segment. We're here for you and happy to answer any questions you may have. Let's start off with asking Caitlin, Dr. Ross, a question. We know that alcohol, its impact on our body starts from the moment we take our first sip, but clearly there's a difference between social drinking and more problematic drinking. An occasional glass of wine with dinner, not really a cause for concern, but these have cumulative effects. And alcohol is beer as well as spirits and wine. Let's talk a little bit about the medical effects. What are these cumulative effects of constant alcohol consumption?
So chronic alcohol consumption can lead to alcoholism. So that's often marked by uncontrolled drinking and an overall preoccupation with alcohol. So people who suffer from alcoholism will continue to drink, even when drinking causes negative consequences in their life, which we'll get into in a little more detail later. But they usually know that their alcohol use is causing these negative effects in their life, but those consequences aren't enough to actually get them to stop drinking. Social drinking can progress to alcoholism when someone starts drinking at an increased frequency, and usually they start drinking more in one sitting as well. And their body eventually starts to become dependent on alcohol, to the point where they start experiencing negative health consequences and ultimately their body.
So, and as you said, we're going to unpack a little bit of that a little bit going forward, but what would be the more common medical things that we see? I mean, I know as a cardiologist, people don't associate hypertension with alcohol, and even moderate alcohol can affect one's blood pressure, sleep disturbances, but what are the more severe medical conditions that you may see in your practice that might make you think of alcohol-related issues?
So the more severe things would be something like liver damage. People can have neurological complications, which I know we'll talk about later. It can be associated with a lot of, this usually isn't caused by alcoholism, but they can be tied in a lot of psychological issues, depression, anxiety, again, sleep disturbances, like you mentioned, and then a lot of accidental traumas as well.
So again, affects quality of life, affects all the parts of the body, can affect mental state, sleep, many parts of our daily routines and health. To Dr. Hammond, Dr. Ross mentioned neurological components. What are the more common neurological complications we see with consistent and excess drinking? And I guess there are two different things, just regular drinking and then the real excess, and we'll define that at some point.
Well, obviously, acute intoxication can cause all sorts of troubles. I mean, if people drink too much, they get into auto accidents. So we see them as head injuries, falls where they've lost their balance a little bit and they trip and fall or injure themselves. So the acute intoxication, or when people drank more than they thought they did, and that kind of thing. That's the acute stage stuff. Then there's the issues of chronic effects on the nervous system. If one gets into drinking regularly, then the peripheral nervous system gets affected. This causes numbness and tingling in the feet and an impairment of balance because the longer nerves in the body get damaged by the persistent alcohol effect. Then there's the cerebellum, which is a balance area in the brain that gets affected particularly adversely with chronic alcoholism. That's another reason for balance impairment. One of the reasons the police put you through that walking the straight line business is because the balance system gets impaired with alcohol. And then there's cognitive issues. The cognition declines somewhat, and there's a chronic alcohol dementia called Korsakoff syndrome, which is a true problem. But there was a fascinating study done in Britain called the British Alcohol Study that ran from like 1985 through 2017, and they followed 550 people over all those years, related to their alcohol use. And in the last 10 years, they looked at the thickness of the memory cortex in the brain, and they also gave people memory tests. And the people who were teetotalers actually had the healthiest looking brain.
Wow.
And even the people with a few drinks a week had some shrinkage of their cortex, but the people who had 3 or 4 or 5 drinks a day had substantial decrease in memory cortex. So the memory declines a bit over years if you continue to drink.
When in your practice, do you see people that come to you for specific neurological complaints and you then are able to make the diagnosis that perhaps it's alcohol related, or is it pretty much determined before people get to you?
Well, it's a lot of people that are closet drinkers. It's been somewhat hidden, and you have to broach the topic of, what is your usual consumption? Do you drink a little bit every day? Do you only drink on weekends? But the people who are persistent or mostly daily drinkers, you always have to try and chase that around a little bit and see whether or not they actually are drinking more than the family is aware of. Because usually we see them because of balance problems or memory issues. That's the commonest issue for me.
Back to Dr. Ross, and I'm certainly we're going to get to Dr. Wandler. Caitlin, you mentioned in some of your introductory comments some of the things that might differentiate someone who we would consider a safe social drinker, even though there might be some medical consequences with someone who might have a problem. This is a very serious conversation, but one of the jokes we use in the medical practice is, how do you define an alcoholic? And the answer is someone who drinks more than their doctor. And what it basically means is it's hard to define what truly determines someone who really has alcoholism. So how do you in your practice, and what can you report regarding how we can help people determine if they or a loved one really has the level of alcohol consumption that becomes really a concern?
Well, exactly. That's a good point, because one of the things that, we kind of note is a lot of alcohol abuse can start with some of these episodes of binge drinking and episodes of acute intoxication. And that's where you're at risk for some of these more short-term injuries that, like the motor vehicle accidents or acute trauma or impaired judgment, where you might engage in activities you wouldn't otherwise engage in. And those are things that can have long-term consequences or even fatal consequences. But over time, generally people increase the frequency of their alcohol abuse and sort of develop a emotional sort of relationship with alcohol. So often, instead of just going out every once in a while and drinking to have fun, they'll start using alcohol in order to avoid boredom or relieve stress, relieve anxiety, improve their mood. And this can eventually result in more frequent drinking, but also can result in a dependency on drinking, both a psychological dependency to the point where someone starts using drinking as a coping mechanism for one of these issues. And that's when risky alcohol behavior can become a more long-term chronic problem like alcoholism. Also, people start to develop a more physical dependency on alcohol. So people can start developing tolerance to alcohol. You'll notice you'll need a few more drinks at one time to reach the same level of buzz or intoxication that they had before, and they start developing withdrawal symptoms when they're not drinking alcohol. And all of these are signs of chronic alcohol use and a more severe problem. And then eventually you start developing the health complications as well that we had discussed.
So in your practice, I know you ask your patients how much you drink and these types of questions. Do you find people are fairly forthcoming? Yes, I drink this amount. And you might say, hey, wait, there's a problem, or it might be heading into a problem. Or do you have to coerce it from people? Are people pretty much forthcoming about the amount of alcohol they consume, and do they associate it with the problem? Speak a little bit about your experience when you're interviewing people.
So I think in general, people are pretty open about alcohol use, but maybe not always open about the frequency with which they're drinking alcohol. So you have to tease that out a little bit. A lot of times, some of the first signs of an alcohol problem could even be a medical condition. You notice maybe elevated liver enzymes in the lab work, and that sort of gives you a little more room to discuss their drinking. Sometimes people, I also, as well as screening for alcohol abuse, I screen for depression. And if you notice someone might, when you talk to them a little bit more about how they've been feeling or stressful events they've been going through, they might maybe even make a joke or discuss that, I've increased my alcohol use because of that. And that makes you a little bit more aware that maybe this is something that you want to look into a little more closely, because they could be using alcohol as a coping mechanism. They could be using it inappropriately, or it could be, they could be starting with the type of alcohol use that would lead to an eventual problem with alcohol. So,
Thank you.
So you kind of have to tease it out a little bit more.
Dr. Wandler, let's bring you into the conversation. Tell us a little bit again about your role in your recovery center, but specifically, we mentioned alcoholism is a disease and it can affect anyone, any age, gender, ethnicity, big people, small people, has nothing to do with religious beliefs and whatnot. We can't really predict anyone's drinking habits, but there are factors that have been shown to be more reliable in who might be abusing alcohol, might have a tendency to abuse alcohol. Can you talk a little bit about what those risk factors are for alcoholism when it actually becomes a problem?
Yeah, I mean, alcoholism, like you said, touches everybody. Everyone's family practically has someone in it who has, knows someone who has alcohol use disorder or alcoholism. I think the things that we see, I've been in this field for a very long time, so the things we see are really early drinking. So, I mean, there's kids that are 11, 12 years old that are drinking on a regular basis. So usually binge drinking at that point, and then it develops into regular drinking. If someone starts drinking, say at 15, before 15, they're probably 4 or 5 times more likely to develop alcohol use disorder, alcoholism, than someone who waits until they're 20 or 21 when it's legal, right? But then it's been mentioned, there's genetics with this, and probably, I don't know, 4 times more likely to develop an alcohol use disorder if you have a family member who has alcoholism, and that's huge. And then there's all the what we call trauma today. There's the dysfunctional family, whatever that means, broken homes, divorce. If a family member, if a parent has an alcohol use disorder, their parenting skills may not be quite as good, or they may not be engaged as much. I think Dr. Ross mentioned depression and anxiety, and that's genetic as well. And so someone who has, sometimes for me, it's hard. I'm a psychiatrist, so it's hard to decipher what came first, the chicken or the egg, i.e. depression, anxiety, or substance use disorder, or trauma. It's all tied in with that. But anyhow, Native Americans have the highest usage of alcohol use disorder, and then Caucasians are next, and then Latinos are third, at least in the United States is how that works.
For someone who might have a tendency to become an alcoholic, a true problem drinker, or dependence, is there a difference between beer and wine or liquor? Is one a higher trigger than the other?
I don't think so. I mean, we define an alcoholic beverage as 12 ounces of beer, or 5 ounces of wine, or a shot of hard liquor such as vodka, gin, whiskey, whatever. And so they're all equal. That being said, if you have an empty stomach and you drink 3 shots of Jack Daniels, for example, I shouldn't use the name, but of whiskey, then you're more likely to feel that because you can't really chug 3 beers quite the same, time. You know, the guidelines we have for women, now women get cheated on this, is really 1 alcoholic beverage a day is all they should consume, and now more than 7 in a week. Men somehow are given double that, so males can drink 2 alcoholic beverages a day and not be considered officially a problem, or no more than 14 drinks a week. So I mean, that's a lot of beer or wine or.
And even that's conventional wisdom. It's a rule of thumb, but you have to individualize the person's response.
Well, right. And a lot of people drink 5 drinks in one day, and then they go a few days without drinking anything. But if you do 5 times 3, you've hit 15 and you've exceeded what's considered, quote, safe for men.
So to that point, that's a good segue to a question for Dr. Ross. People tolerate alcohol differently. Some people can have a drink and they can get buzzed. Other people, as like one that's like can drink several drinks and may not necessarily feel it. What are the different stages of alcoholism? And again, I think this is certainly important for the viewer, but maybe a loved one of the viewer that they may recognize and be able to help someone. So can you speak a little bit to the different, stages, if you will, of what may lead to an alcohol dependency?
So generally, one of the first stages is binge drinking. So that, I know we talked about the recommendations for men and women. Binge drinking is defined as 4 drinks for women and 5 drinks for men over the span of about a few hours. And it's generally the amount that can make you acutely intoxicated. And this is when you can sort of experience some of the negative consequences from some of these accidental injuries we had mentioned earlier. People may be involved in accidental falls, motor vehicle accidents, drowning, their judgment's impaired. They may engage in activities they would not normally do, like spend money, have unprotected sexual intercourse, or engage in other drug use. So some of these complications from binge drinking can be some of the first signs that someone's having a problem with alcohol.
Caitlin, if I can interrupt before you go to the second point, does it matter if they're doing it on their own, watching TV, or if they're out socially with friends? It's 4 to 5 drinks.
No, it does not matter.
Right.
Yeah, exactly. It's the same amount. It's the same amount of alcohol, and it's basically the amount to make you intoxicated. So you're right. In some cases, some of these people might not experience the same consequences if they're at home drinking this amount. Maybe they have less opportunity to become involved in any kind of accidents. So it could be a little bit harder to identify depending on the situation, but that's sort of the amount that they give you, the 4 drinks, 5 drinks in one sitting.
So the binge drinking would be the first step. Apologize for interrupting.
Right. Yeah. And then the second step is kind of moving on to increased frequency of drinking. So instead of maybe, binge drinking every once in a while, going out to a party, you start doing it every weekend or even every day. And again, this can be the kind of thing going out with friends or doing it by yourself. And at this point, people are really developing a bit of an attachment to the alcohol. So they might be doing it to improve their mood, alleviate stress, anxiety, some of the stuff we had kind of talked about before. So this increased drinking can progress to what we call problem drinking. That's the next step. And that's when people, not only are they drinking a lot and maybe having episodes of binge drinking where they're acutely intoxicated, but they start experiencing negative consequences in their life. So this could be problems at work, school, relationship problems, legal problems, financial problems. Some of this can be stuff that's related to their behavior while they're intoxicated. And other signs of problem drinking can include like a change in their friend group behavior or increased social activity or even social isolation. So it's sort of important to note that a lot of these behaviors can be a little bit harder to identify during the pandemic when we've all kind of been socially isolated at home and working from home as well. People may not be having some of the same negative consequences with work or legal troubles or that kind of thing, but that's still sort of one of the hallmarks of problem drinking when you start. And, and also we start experiencing health complications as well. The next stage would be what we call alcohol dependence. So that's not only are you drinking a lot and really your life is suffering because of it, but your body's physically dependent on the alcohol. So it's really become part of your routine. You've lost control over your alcohol consumption. It's not really an activity anymore. It's more of a coping strategy to sometimes relieve some of this anxiety, stress, or sort of whatever it is that maybe got you starting to increase your frequency of alcohol use. People may do stuff like lie about their alcohol use, physically hide bottles of alcohol or something like that. So you could notice some of that behavior. And they also may start developing withdrawal, symptoms of withdrawal, like tremors, irritability, nausea, palpitations, sleeping issues when they're not drinking. So you might notice a change in someone, if they're acting differently in the morning or something like that, or even some people start maybe having alcohol in the morning. This is something they might be more likely to hide, but that's definitely a sign of alcohol dependence. And this eventually leads to an addiction to alcohol when someone really has the psychological, physical need to drink, and they really feel like they need to drink alcohol to feel normal and feel better.
So it's great information, and it's not as if a switch is flipped and you go from one stage to the next. It actually can be a very gradual transition, which is why self-reflection or looking at others and you're looking, to support loved ones is important. It was binge drinking, increased drinking, problem drinking, alcohol dependence, and then the true addiction and alcoholism is the transitions. Dr. Hammond, again, Dr. Ross mentioned we mentioned a couple of comments about the self-control, decision-making. Again, the brain effects, you talked about chronic alcohol effects. Talk a little bit about what happens when people are drinking, which makes them kind of want to drink, the pleasure and some of the other components of that. If you could speak a little bit towards, what happens to the brain when someone is drinking.
Yeah. The neurobiology research in alcohol use disorder has been quite interesting. There are three major brain structural areas that get affected. The basal ganglia are deep structures in the brain which play a big role in the reward system for the brain. Okay, so this is where your pleasure centers are, so to speak. And alcohol, like other addictive drugs, tickles that area very well. And the pleasurable sensation you get a little bit of a high from having alcoholic beverage triggers the need or the desire for more of it. There's another brain area called the amygdala complex, which has a little bit to do with the negative aspect of alcohol, the withdrawal of when it comes out of your system, a little bit of how you behave to that, anxiety that can happen as the drug leaves your system. And then there's the third part of this package is called the prefrontal cortex. That's really where your behavior control is. That's your executive function. That's where your control centers for your behavior are. And that's where you actually develop an anticipation or the thought about the next drink. And that's how the addiction end up actually happens as time goes on. Intriguingly, I think our psychiatry colleague mentioned that the different ages play a role in here, and I think the public should be aware that in adolescence, the brain is much more susceptible to addiction or the addictive capacity of alcohol, like it is with other drugs, and of a teenager, or if I decide to start drinking, there's about a 10 or 11% chance I become addicted to alcohol. I'm not young anymore. Not adolescent. Adolescent decides to do that, it's about a 30% chance they get addicted. So it's almost a threefold increase in the addictive capacity for these drugs. So that and alcohol is in that package. But anyway, the brain wiring gets set up a little bit by the reward system, to really enjoy it, and then before you know it, they don't like the withdrawal part, and then the prefrontal cortex gets to anticipate the next drug, and so your frontal cortex has to control your behavior, and that's where you can get into trouble by inappropriate decisions in terms of what's going on when you're drunk.
So I think, and all of you have been great guests in iterating the importance of recognizing alcohol has certain pleasurable components, but in certain situations for certain kinds of people, it can lead to problems, both health related, have a mental toll, actual physiological changes to our body and our brains. And I think that's the most important points we want to have our viewers recognize. Last question before we take some questions from the viewers. It's to Dr. Wandler, and I guess it's the $60,000 question, if you will. It's hard for someone who has alcohol dependency to quit drinking. Why is it so important for someone suffering from alcoholism? Why can't people just say, well, it's not good for me, I'm gonna give this up?
Great question. It is the $1,000 question, $1 million question. Some people can just give it up, but our brains get hardwired, especially as Dr. Hammond said, and I earlier said, with young kids, the brain wants pleasure, and think of a teenager, they want it now. They don't have a breaks, they want the reward now. And if they start drinking early or using other drugs early, they get hardwired very quickly. It's a chronic disease. I work with alcoholism. That's what I do, and drug dependency. We have, a center that we're partnered with Baptist Hospital near West Palm Beach, and we have an outpatient clinic also really close to the main campus of Baptist. And so we are working with people, trying to get them the help they need. Sometimes we have to use family members, or loved ones, or their partner, or whatever, to help get them into treatment, because they don't want to give up that pleasure they have. For those that, like Dr. Ross said, have gone to the very severe end, stopping drinking, their body starts reacting negatively, called withdrawal, and it's uncomfortable. They may start shaking, they may, start throwing up, diarrhea, headaches, cardiac issues. And for someone who's been drinking a long time and a lot of alcohol, they can go into a very serious state called delirium tremens, or DTs as we call it, which is a medical emergency. They have to go to the ICU to be treated. I can't treat that in my facility. We're not a hospital. So
I think part of that take home point again is it's a disease, it's a dependency. We don't judge. In my practice, I tell people who smoke, I don't judge you. You're addicted to cigarettes. Let's try and work to figure out how we can help you get rid of that dependency. It's not something that the person may even want to continue smoking. Similar with alcoholism. So question from the audience to Dr. Ross related to that. If someone's seen a friend go from a social drinker to drinking a bottle of wine every night or more, how can someone help a loved one who has a drinking problem get help and go to treatment?
So one thing you can do is just start off by talking to them when you know that they're going to have time to talk, when you're both calm, no one's drinking, no alcohol involved, and express your concern in a very caring way. So avoiding any kind of blame, judgment, maybe get them to open up a little bit about why they've been drinking, if they've been experiencing any new stressors or anything, increased loneliness or anxiety, or if they even see their alcohol use as a problem, because a lot of people don't. So it's actually alcoholism is really marked by denial of their drinking and the problem that they're having. So it's normal for expect a little bit of pushback when you're bringing up your concern to a loved one, and realize you might need to have a few of these conversations with them before they acknowledge that their alcohol use is problematic and are really ready to change. And try not to act negatively when they do this. But you can really start. There's a lot of different places you could start in terms of getting them help. So you could even just go to your primary care doctor, bring that up. You could bring them to a counseling session, therapy session, an AA meeting. You could call it helpline. And sometimes for someone who has an alcohol problem or is an alcoholic, it can be a little scary to kind of start off with this. So you might want to offer to accompany them to one of these sessions if they want that. Another thing you could do is if they're experiencing any medical side effects from their drinking, if they're, at the GI doctor with horrible gastritis or a liver problem, you can enlist the help of the doctor there to sort of explain to the patient the relationship that alcohol has on their physical health and really encourage treatment. So those are really great ways to start.
So again, first recognize it, and then obviously resources to help the person or yourself. I really want to thank you all for sharing your insights with the audience. This is an important complicated and difficult subject. To our viewers, you connect with us in our social media channels, Facebook, Instagram, Twitter, LinkedIn. Check out the resource blog for the latest news at baptisthealth.net/news. You'll find a link there to all the episodes of the Baptist Health Talk podcast as well. On behalf of everyone at Baptist Health, we ask you to please stay safe, do your part to stop the spread of COVID-19. Mask up, South Florida.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Resource Live is brought to you by Baptist Health South Florida, healthcare that cares.